shoulder.
Alright. How would you rate the shoulder pain from 1 to 10?
Yeah, I like 7.
So, alright, so we're gonna start with the body buffer. I'm gonna work on the glutes, low back, and then hit the upper back after, okay?
Yeah.
Here we go, 3, 2, 1. So right now we're just trying to improve circulation to the muscles. We're getting rid of all that lactic acid buildup that makes the muscles sore. And then it also helps with lymphatic drainage too. So the body's way of kind of removing waste, that's like your lymphatic system. We're hitting the glute max. You feel like your hip tightening up a little bit?
It's more like it's popping.
It's popping, yeah. So the muscles here are very, very tight. So I'm just trying to giving it a little bit of stretch here to loosen this up. Now we go the opposite way to hit like the glute, and then you're gonna fly straight up like Superman,
Yep.
and then twist your thumb down, okay?
Alright.
So I'm gonna basically be applying a pressure onto like the shoulder blade area. So slowly go up. Good. Come back down. And up again. Good. So now as we do this, we're opening up the shoulder to free up that range of motion. Good. Last one. So how did this all start?
So basically just wear and tear. I'm working out very often. Basketball. I feel my body's very sore after basketball, so that's a big key. And also just working.
Is it hard to recover in between, like, or do you notice that, like, with diet too, you?
Yeah, with diet and everything. Also just being able to come to, you know.
How's your hydration, by the way? Like, you drink a lot
It's good.
of
Yeah,
electrolytes?
I got a massage not too long ago, and the lady
Good.
like a real like.
You feel like it loosened up a little bit.
Yeah, and also they're like, yo, your muscles very hydrated. And everything,
Okay.
So
So what we're gonna do now is we're gonna go right to the adjustment. So I'm gonna do the mid back first.
Okay.
Then we're gonna do the low back, and then we'll do the neck at the end. Okay.
Perfect.
Any questions?
No, nothing.
Your hands behind the neck. Perfect. Elbows together. You're going to curl forward and then come all the way back to me. Good. All right. So for this one, I want you to take a big deep breath in and then just let it all the way out. Good. Come back up. How'd that feel? So I'm just gonna tension this out, take all the slack out, and then a very quick push. Drop this shoulder here. Good. A little more. That's it.
I already felt poverty turn.
Yeah, we got one pop already. We save the best for last usually. All right, same thing with this one. Drop, drop, drop.
Oh.
There we go. So that was the tiny one. Not bad. You feel some pain here?
Yeah.
Like a little
Or a
tight.
soreness.
Okay. So I typically do a little bit of muscle work before each adjustment. So as I do this, it kind of helps loosen up the joints to set me up for a nice smooth motion in here. So sit on back.
Yep.
Just relax. Good. So I'm gonna take the head to the side, right? We're gonna keep bending the head until we feel it lock out. And then as soon as I feel that lockout, it's just
Oh, that was good.
just like that.
Yeah, that was a good one.
Amazing.
Wow.
So same
Wow.
thing. That was really loud.
That was
actually.
loud, bro.
Damn.
That shit felt good.
Bring it to the side a little bit more. I want you to count to 3 out loud for me.
1.
Too fast. That was it.
That was
Now
good.
turn the head left and right, see how that feels.
Yeah, way better for sure.
Not bad, right?
Not bad.
Beautiful. That's it. If you can get this in 2 shots, I'm gonna give you 2 tries, alright?
Yeah.
Today's visit is totally free.
Let's
But
do
if
it.
you miss,
Frio.
you pay double. And I know you're a gambling man.
Let's do it.
So
Let's do it.
Alright, let's see what you got. There goes 1.
The assist from you, so you know it's good.
Oh, one more.
It's double.
We're gonna take Sean back now. We're gonna do his x-rays, his exam.
Alright.
So follow me and you'll kind of see what we do here. Alright? So come on down. This is the part that we're gonna just do all the exams, take the x-rays, we're gonna measure you so we can get a better idea of kind of like what's going on with the body.
Okay.
Being that you're taller than the average person, what happens to people is the weight with, you know, gravity, and of course when you're kind of rounding your shoulders, it's going to put a lot more pressure on the neck and the low back as well.
Okay.
Where do you usually feel like your pain most of the time? Is it the neck, mid back, low back?
Neck and lower back.
Okay.
Both.
So do you ever get any like headaches at all, anything like that?
No headaches, but I get a lot of tightness like behind the shoulders, behind the neck, and the lower back for sure.
Okay. Are you a side sleeper, back sleeper?
Side.
Side sleeper.
Yep.
Okay. What I recommend for that, because a lot of people have issues like with sleep, is always try to put like a pillow in between your knees.
Okay.
That way we can keep the pelvis square so that it's not kind of like jamming packed together.
Okay.
Number one. Number two, do you do a lot of like sitting for work? Are you standing a lot?
Combination of both.
Combination of both. Okay.
Yeah.
So a lot of times for sitting, for example, all the pressure on the back goes to like the last two vertebrae.
Okay.
More importantly, the last vertebrae. So over here, this is like the typical spine, and most people that have a normal curve, you can see over here, there's equal space in between each of these vertebrae. Now, when you start to have more issues, all of the weight, for example, on this side, you can see is putting the pressure on the back, and eventually you'll lose the space in between the discs. So every vertebrae in the spine has a disc that gives it like a cushion.
Right.
That cushion is like your body's like natural shock absorber.
Okay.
So we just want to make sure the health is intact of that cushion so that you have no issues. Now, have you had any like injuries or like traumas or accidents in the past or no?
No, nothing crazy. I pull my lower back out though twice
Okay.
a year.
So like, do you notice that happens like when you're lifting?
Lifting weights. 100%.
Lifting weights.
You ever get the space back between the vertebrae if you lose it?
So good question. You could, but this is going to take a lot of like spinal decompression, like flexion distraction. There's a table that basically flexes your body up and down, and it kind of pulls the body apart. So that negative vacuum effect creates that reabsorption of the disc. To answer your question, yes, but it does take a little bit of time. Just standing nice and tall like this. I'm going to do first over here. So that is about 11. We're going to decide that's about 12. 11 and 12. We're gonna now bring your arms up right here. Good. This is 32 by, there goes my pen, 29. All right, cool. Okay. The first one in 3, 2, 1. Don't move. Wow. I actually can't believe this. Yeah. You have some bones that are kind of trying to fuse over here. I'm glad I took this x-ray. Normally, we ask patients to take any metal off of here just because it's going to kind of blur what we're trying to look at. But for the sake of this.
Sake of Jesus Christ, let this one slide.
Exactly. Now I want you to bring your chin. Okay, you can relax your head to neutral. Now turn your whole body and face me this way. That'd be great because the rest of this I definitely need. There's a lot of bony fragments here that's trying to form. So this we can't fix necessarily, but we can help at least halt the progression of that fusion. This is to access the two bones that are in the neck that I actually can't see because your teeth are blocking it. So in a second, I'm gonna position this to your mouth, and then you're gonna open wide when I tell you, and then we're gonna take the image like that, okay? I'm gonna bring this up to here. Open wide, don't move. Perfect, you can relax. So this is good. I'm looking for an equal space on both sides, which is excellent. He has some dental work here. You can see that on the x-ray here. Now we're gonna do a tube tilt. So we're gonna bring this down now, and it should go right where his Adam's apple is, which is perfect. So we're gonna open this up. We're gonna bring it to the side so I can see his lung fields also. And we do this because we also wanna make sure that, God forbid he had any tumors or anything like that that's showing up on the x-ray of the lung, we can pick it up at the apex over here. So that's why we do this. 2, 1, don't move. This is his hoodie, these little metal things over here, so that's no big deal. Lung fields look clear, I'm happy with that. And then these joints are looking fine. Now we're gonna save this, and we're gonna do his low back now. He has 2 more, and then we're finished. You're 6'7" or 6'8"?
6'7".
6'7"? Okay.
I'm not gonna lie.
In the morning, right? All right. So for this one, we're gonna locate where your hips are. I want you to take a step back all the way against the board. So part of my reach here, I'm just gonna reach around over here. So once we find, would you say your hip is about right here?
Yep.
Okay. Let's see how this came out.
That last disc is what I fucked up. Whatever was the last one at the bottom is what I messed up.
Yeah, so this is the pelvis right here. He has a little bit of a lean towards his left side, but hips look pretty good. His right pelvic, like iliac crest here is a little bit higher, so he's probably leaning on this side more, so we got to work on that. If you did this right, this line should go right into the armpit, which it does, so it's perfect. So same breathing technique. Big deep breath in. Blow it all the way out. Keep going, keep going. Stop breathing, don't move. Breathe normal and you're done. You can have a seat. So you can see over here, you see this space that we have here? The more you go down, you can see the height of the disc gets shorter and shorter, and he has a little bit of pinching over here. So this is something we need to focus on.
I'm at the point where like it's tight, man. If I move certain ways, I get the spasm.
You feel it, yeah.
It's kind of like hyperextension. I was doing the leg raises,
Okay.
hanging, and my legs came too far back when I was trying to get like the last couple of reps, and I just felt the pain go right down my lower back, and it's been a week of hell.
And the rest is history.
Week of hell, man.
So I think what you should be doing, number one, like I said, stay hydrated.
Yep.
Magnesium is a good muscle relaxer. It's natural.
Okay.
Rest is definitely important, but any type of like walking or anything to try to loosen up those joints, those areas is fine. So I'm good with that. Just try not to lift. Whenever you do lift, always use your hips for anything versus using your back. Again, because you're tall, the fulcrum that you have over your hips is a lot different than somebody else who's like my height, for example. These are your first set of x-rays for the neck that we're looking at right here, okay? Now, what I'm looking for is some nice square vertebrae. The next thing that I'm looking for is the alignment. As we go down over here, I see some arthritic changes that are happening, but when we go even further down, if I press to focus in, you see how like this is smooth, like a little, like a chip over here, and then this over here. So these areas of the vertebrae, they're trying to fuse together. And eventually, if we allow it to fuse together, you're gonna lose individual motion of each vertebrae. So for example, let's say you have this guy and this guy, one guy can move here, one guy can move this way, they're both gonna be moving together in unison.
Okay.
That's not necessarily good because that's how arthritis just kind of builds up and it kind of creates rust in the neck.
Okay.
And the reason why I asked you earlier about if you've ever been in any car accidents is because a lot of times whenever there's trauma from like whiplash or anything like that, arthritic changes start to happen without us knowing. And because like the sudden trauma and impact, our bodies start to get smart and say, hey, let me start depositing more bone to that area, or let me just try to get stiffer to support it because it feels unstable. So this is where your neck is supposed to be versus where it is now. Now, because this is not here and this is not here and all these are there, it's creating a lot of pressure right where this joint meets. And in that area, believe it or not, there's nerves that are coming out of the spine, right? So this is an example of a low back lumbar spine. And you can see here the nerves that are coming out of each spot. Now for you, what's happening is you have them jamming together, and when they jam, it starts to look like this one. And then over here, when the disc decides to herniate, if there's not enough space, it'll irritate that nerve, and that's what gives you pain. Now, you do have some rounding of the shoulders here as well, and that's again something because when you're taller, people start to hover over a little bit to accommodate for us short people, right? So we want to bring the head back here in order to create a nice plumb line so that your body is aligned. So for example, your shoulder could be out because when you're rounding this forward, your traps in the back are squeezing, being pulled. Your pecs get tight because they're constantly doing this. So if you go to stretch, it's gonna feel good, but it's gonna be a little bit tender up here too. Over here, you can see left side, right side of the pelvis. Not a trick question. Which side looks higher to you?
The right side.
The right side, right? Clear as day. We go to the height and we draw a line to the height of this part. So you're off by 16 millimeters. That's more than 1/4 of an inch. That's like 1/4 and a half.
And that's the left leg. I think when I was 17, I had ACL meniscus surgery.
Right.
And I think that leg might have stopped. Like that leg's definitely a little shorter than my right leg.
Most people have an 80% chance of being an anatomical short leg, which just means the way that you stand in the anatomical position, your body's off. And then the 20% of people are actually born with a structural shorter leg. So you necessarily might not have a shorter leg. It's just because of the fact that all the muscles in your body that are trying to overcompensate for the imbalances or the overcompensation are creating that artificially. This curve is beautiful. This is like a textbook curve. But you see the beautiful space here? My cursor can fit in here excellent. Almost I can put two of them. But as we go down and down over here, this one is touching the top and the bottom, which means the lower disc height over here is due to compressive forces working out. If you're sitting for long periods of time, for example, all of the weight with gravity is hitting right on this one peak. Okay, so this, I don't want to say this is like a herniation here, but the pressure that you're putting over here, eventually over time, it could even cause even more pain radiating down your leg. Beautiful. See how the line just touches the whole entire thing? Now, this curve and this curve should be identical, and they're not. You came for low back pain, and yet I found this. Going forward, the next question that everybody has for me is, how do we fix this? There's either relief care or corrective care. Relief care, you just come in whenever you're able to. We do some muscle work, targeted in those areas that you have the complaint in. That's relief care. Corrective care is a 3-month program that I put people on where we target the root cause of the issue. Okay? So you're going to be getting the adjustment, you're going to be getting the muscle work. You're also going to be getting mechanical traction, which is the posture pump, which is really, really important because this device right here is what helps create that nice curve by pushing the neck into extension and depressing the shoulders downwards. So if you ever had like a retainer after you take your braces off, this is the retainer for the neck and the back. We're gonna eventually get you to the point where you don't need to see us that often. So the first month, 3 times a week, second month, 2 times a week, the last month is once a week. And then the goal, like I said, to bring you to every 4 weeks. Okay? Your body, you gotta think of it like you're a well-oiled machine and I'm the human WD-40. Your nervous system's gonna operate at 100%. You're gonna get better sleep. You're gonna get better range of motion.
Need that.
And you're just gonna be able to have a better quality of life. That's the number one thing that we're looking here. Shockwave therapy is doing, it sends these radial pulses deep into the tissue to help create a disruption that elicits a stem cell response. Those stem cells go in and your body helps heal itself naturally from within. So by doing that, you don't need surgery, no downtime. You might feel a little bit of like soreness, but that's normal. But you're gonna feel already an increase of range of motion even after the first treatment.
Perfect.
And guess how long it takes? 5 minutes.
Wow.
That's it.
Try it out.
Let's do it.
You're gonna need a bigger room.
I know, right? Alright, so we're gonna do the mid-back adjustment first for you, okay? So I want you to sit up. We're gonna place this right over here. Now, what I want you to do is you're going to interlace your hands behind your neck. Perfect. Elbows together for me. Good. You're gonna curl forward and come all the way back to me. Good. Now, take a big deep breath in and just let it out. Good. Come back up. Hear those pops in there?
Yeah, my shoulder too.
Yeah, bend this one. They say the bigger they are, the harder they crack. Let's see. I won't leave full, I promise. Drop the shoulder more. A little more. Man, that's stuck. Bottom leg is fully straight. Good. Drop more. A little more. Wow. Yeah, definitely tight. Alright, come on back. You're on a vacation starting this moment going forward, okay? I'm gonna do all the work. Where do you want to be on vacation? Bahamas, Miami? Bahamas, okay.
Sure.
That's a nice spot. Alright. So I'm gonna take a contact, bring the head over here. Where's your favorite place to eat?
Oof.
Too fast. Couldn't even think. Alright, got a little tiny one in there. Drop the head to me. Bring your knees together. There you go.
That's a
Not
good
bad.
one.
Not bad. So your neck didn't have that many pops. Do you crack your own neck?
Sometimes, yeah.
Yeah, so that makes sense. So I want you to stop doing that because what you're doing in essence is you're creating more arthritis in the areas that don't move, and the ones that move a lot, they're just popping so easy so that you're gonna kind of self-adjust and you're gonna feel a difference. But the ones that need to go, they won't go.
Okay.
So my job to come in, I kind of take tissue pull out and I get the exact areas that I need.
Okay.
So that we get your body moving good. Sound good?
Yeah, it's tough not to crack it, man. It's
I
tough.
know. First, this is a flexion distraction table. This is basically just gonna bend your lower back up and down. It's very passive, very relaxed. Then afterwards, we'll do shockwave for the shoulder. You're taller, so I gotta bring this. I always take a towel, roll it up. We're gonna put it under the hot water here to make it a little bit comfortable for the patient. And we're gonna take an ice pack, and then we get the muscle stimulation electrodes right over here. I like to put these on the hydroculator to warm up so that they're not like freezing cold for people, because every day is patient comfort day. So there's that. Now, although this is like temporary relief, a lot of people love this because of the actual relief you do get. So if I can get you out of that pain cycle, even for 10 minutes, I'm happy. We do crisscross, red to red and black to black. Just like that. And then now we're going to put on a nice warm towel. Don't get used to it because we're going to hit you with the ice in a second. Alright. And then here comes the ice. Beautiful. Okay?
Yep.
Now, let me know when you first start to feel some tingling, okay?
Okay. Tingle.
Okay?
Yep.
Now let me know when it's comfortable, but what I don't want is for the muscles to start twitching like this uncontrollably, okay? So I'm actually gonna stop it right there because I'm also gonna be using the F&D machine for you. So we're literally just bending his waist from here down. And what this is doing is it's gapping that vertebrae so that we can actually give him a little bit of relief so that the body can take a pressure off of the nerve that's kind of giving him pain. I'm just gonna bring a little bit of this stuff here. We're gonna bring you down to 2 bar.
Where it gets all, it's right in
the front, right? Like front delt area? Okay. So here comes the first. Let's go over here. The areas that are going to feel a little bit more tender, that's how we know we're going to be on that spot that we need to be on. So if it feels okay, we keep moving. Every cycle of the shockwave, yeah, it's 3,000 pulses. Okay? Right now we're at 750. So that's why it takes less than 5 minutes basically. And I'm just tracing all the muscles here. Eventually we're gonna go to the back. You're also gonna notice in the area that I'm targeting, there's gonna be some like irritation and increased inflammation here. That's okay. You want that because you want the body to help bring that new blood to the area and the stem cells to help actually fix the body from within. You can see in here too that there's a number counter. If you zoom in, you can see as we move. Feels like a lot looser, right?
It's light, yeah.
Good. Upper traps for you are definitely tight. I can feel it. So I'm starting with that. I'm gonna do about like 500 pulses, and then we're gonna kind of work our way down to the shoulder. So he's got a lot of muscle, which is good and bad. There's a lot more things that we have to like work on rather. So I'm just tracing all the muscle fibers for him, so that he gets the range of motion in every direction.
No issue whatsoever.
No pain, no issue?
Nothing. Just completely normal.
Excellent, excellent. Now you might feel some like crepitus, like that cracking sound in here, that's normal, but we're breaking through those barriers. A lot of the scar tissue that's in
what's
here,
nice. Okay.
again, we just gotta get it moving. As soon as it moves, we're good.
Feels good, man.
Excellent. Let's see if you can make it in. Ooh, alright. I'm gonna give you 2 chances, alright? If you can get this in, I will give you 2 shockwave therapies on the house, alright? So, you think you got it?
Got it.
Alright, let's see. This guy. Now, depending if you prefer side or back, usually whatever you tend to fall asleep with is what I recommend. However, give it 2 weeks to a month to assess your sleeping. You gotta dedicate at least 2 weeks because it's gonna feel a little bit weird at first. But once you get used to it, travel with this pillow wherever I go, even if it's a 2-day trip. I put it in my suitcase, I take it, people make fun of me, my whole family makes fun of me. I don't care. I get the best sleep and they don't. So there's that. Width over here, so shoulder to shoulder. Raquel, he is 41. Shoulder width. We're gonna do the neck height. Neck height is 22. Okay, and then we're gonna do the circumference of the neck. That's 44. What'd you do different?
Not come Friday and Saturday.
Okay. Did you do any like stretches like the small armpit one I told you about?
I did do some stretches.
Okay.
And I did work out yesterday. I did not work out between Thursday to Sunday.
Okay.
I did feel the sudden shocks in my lower back. I have burning pain on my way here, and my back overall has been.
Of course.
I did bad, right?
You did a little bad, but you're here and that's all that counts.
There's room
Okay.
for improvement.
Always room for improvement. Drop the shoulder a little bit. I gotcha.
Oh.
That's it. Roll forward and then come back. Good. Let's get a big deep breath in and just let it out. Nice. Any headaches today?
No.
Good. Sit all the way back. I gotcha. Drop it down to me. Keep letting it fall.
Oh.
Good. Good. You see stars yet?
Yes, I
Okay.
saw all of them.
Can you count to 3 out loud for me?
1. Oh.
Got it. We got it.
Oof, child.